On that, we begin with State Circle's Yolanda Vasquez.
This is my medication for a week.
Barbara Lancelot has become an expert in makeshift medical care.
They have several different programs for people, and all the directions are there.
The 60-year-old Montgomery County resident who suffers from arthritis, fibromyalgia, and depression has had to piecemeal her medical coverage ever since she lost her job and her health insurance 2.5 years ago.
So the first thing was to try and figure out what I could do about my medication costs.
Two of her most important medications cost about $600 a month. Lancelot stopped taking them until she discovered various prescription assistance programs. Further research led her to a state-run therapy program that provides free counseling and a community clinic that would take care of her immediate medical needs.
Whenever I had any acute illness, they were very efficient in taking care of that.
Sometimes I give up. Sometimes I just sit home, I cry because I get tired. I just be frustrated. I just be so frustrated that I just don't know what to do.
Jessica McCallum Johnson has been out of work for over a year after seizures and migraine headaches landed her in the emergency room. Doctors found a malformation of blood vessels in her brain. It's treatable with surgery.
Even a consultation for me to go in costs $171. I told them that's a lot of money I don't have.
Jessica is covered by a state assistance plan, a plan that won't pay for surgery but does cover anti-migraine and anti-seizure medications.
One day I had like 4 in one day, and they told me if I had another one, I wasn't going to make it. So it's like I'm just be worried, sometimes that I don't know what's going to happen to me.
Hi, Ms. Starks. Hi. Dr. McCauley, nice to see you again.
Dr. Jeannie McCauley knows the plight of the uninsured.
A lot of people will come in here and they'll say they haven't been seen by a doctor in years, or they have a medical condition that they haven't had cared for.
The waiting room at her community health care clinic, run by the Baltimore Medical System, is filled with and underinsured patients. They offer primary care for both children and adults.
The more I work here and the more I see what can be done for people, and fairly simply, we can do so much to make people feel better and not get worse.
But McCauley worries about the patients she doesn't see and the challenges they face trying to survive without adequate medical care.
I'll say, why haven't you been here? And they said, well, I didn't have any insurance and I didn't know you existed, which is really heartbreaking because a lot of them have started to suffer complications they didn't need to suffer.
Lancelot has become a tireless advocate of healthcare reform, working with a local advocacy group. She created this button to remind people that we are at a critical point in our country's healthcare crisis and that now is the time for change.
And I'm looking at a very much diminished life because of the circumstances that I'm in, and I am far from being alone.